Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks.
This is episode 136, Deprivatization. What is deprivatization? It is moving functions from private, for-profit organizations to publicly funded government entities or to private nonprofits funded by the government. In healthcare, the evidence is overwhelming that moving from private, for-profit businesses provides better service at less costs. We will be examining 3 examples of this. The first example is Medicaid deprivatization. Connecticut deprivatized Medicaid in 2012. They did this by terminating contracts with their for-profit managed care organizations, or MCOs, and moving to state-run programs. Connecticut reports that it has saved more than $4 billion in the intervening 13 years, and its agency administrative overhead continues to fall. In 2018, Connecticut spent $395 million on overhead. In 2022, they spent $353 million. That is $42 million in savings. Patient care also improved when Connecticut dropped the MCOs and deprivatized Medicaid. Early cancer detection increased by 4.7%, and the cancer survival rate was 8% higher than New Jersey, which kept its privately run Medicaid MCOs. A study done by Physicians for a National Health Program, or PNHP, calculated that in 2023, Medicaid deprivatization would save the states and the federal government anywhere from about $46 billion to $78 billion. The second example shows that deprivatization can also save money in other areas. And Ohio illustrated this when they removed pharmacy benefit managers from their Medicaid program in 2022. Ohio saved $140 million over a 2-year period. They also boosted the dispensing fees paid to retail pharmacies by 1,200% and expanded the network of Medicaid participating pharmacies. The third and final example of deprivatization is with Medicare. Technically, with Medicare, the issue is how increasing Medicare privatization has increased costs, but the effect is the same. Public funding of healthcare provides lower cost and better care than paying private for-profit businesses to insure people. Medicare makes comparisons easy because you can compare traditional Medicare with Medicare Advantage. Medicare Advantage consists of plans mostly run by private for-profit health insurance companies. I have discussed the problems with Medicare Advantage in previous episodes. These plans cause serious problems for patients with their care denials and prior authorizations, which can lead to more health problems and possibly even death. Medicare Advantage costs the government over $1,000 more per patient than original Medicare. A PNHP report calculated that in 2022, Medicare Advantage plans overcharged the government somewhere between $88 billion and $140 billion per year. The Congressional Budget Office calculated that traditional Medicare spent 1.5 to 1.8% on payers' administrative spending, while the private insured plans had administrative costs averaging 16%. As we can see, traditional Medicare, which is a single-payer healthcare system, is more than 8 times more efficient than private health insurance. Here is even more evidence for the need to deprivatize. The Medicare Payment Advisory Commission, or MedPAC, stated that for 4 decades, plans similar to Medicare Advantage plans have, quote, never yielded aggregate savings for the Medicare program, end quote. I'm not sure why after 40 years of failure, Medicare still bothers using private for-profit companies. In building on my previous point, I'm not sure why we keep insisting on using private for-profit healthcare companies when the evidence clearly shows that they get worse health outcomes and cost more than using publicly funded healthcare. If we want to improve health outcomes and save money, we must deprivatize Medicaid, Medicare, and the rest of the U.S. healthcare system. Thank you for listening.
You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.